It's very scary. If there was a serious outbreak, we would run out of masks in 2 days.
Dr Maria Bolton's GP clinic in Brisbane has 15,000 patients on its books. She's deeply concerned by what she says is a severe shortage of face masks and other protective equipment as the coronavirus spreads.
No GP in Brisbane or in Australia has enough PPE to last us through this pandemic.
Their commercial supplies have run out, and now doctors are being forced to personally search for masks in shops.
The hardware stores, yes, I've been there trying to get some. They're out of stock. We need these masks now.
When she sought an urgent supply of more P2 masks from the local public health service, she was told that due to high demand, she could only have 2.
I don't know that they know how dire things are. They need to really support us, general practice, because we're the ones that are going to be in the front line.
Have you spent any time overseas in the last 14 days?
I am extremely concerned about my doctors getting sick.
Sweats and fevers, as well as muscle aches.
Today, after repeated calls, Dr Bolton's surgery was given 50 extra surgical masks. But she says that won't be nearly enough, and they're not the right kind of masks for dealing with patients with coronavirus symptoms.
50 masks will probably last us 2 days.
In a statement, the clinic's local public health service said there was only a very limited supply of face masks available for GPs from the national stockpile. They also acknowledged there was a shortage of protective gear like gowns and gloves. Even though Dr Bolton's been assured that another 100 masks will soon arrive, they won't last long either, and she's worried that other doctors are facing the same battle to get adequate equipment.
If it's not sorted out, we face having sick patients infecting doctors, doctors having to stay home, and having to close our doors.
So it's 6:30 in the morning and just like normal day.
In China, Rui Severino is one of the few Australians who chose to stay in Wuhan after the virus struck.
And we have to come and get our temperature taken at the gate, a security guard. Oh, so 35.9, I'm clear to go. Boys just getting the horses ready.
He runs a horse training facility near Wuhan, ground zero for the virus in China, and has been in lockdown for more than a month.
Yeah, this is an improvised kitchen that we had to make, where we cook our meals. My biggest worry is to know when will this virus outbreak will finally be over and can think about seeing my family again. To my sons that live in Australia, they are the reason that I keep going really strong. I do miss you every single day.
Thought I'd give you all an update.
The gentleman who lives up there, he died.
Another Australian, Tim McLean, wasn't able to get any of the evacuation flights out of China. He's quarantined at home and says supplies are dwindling. He's mostly surviving on vegetables.
It's a nice fresh box show we got from the government the other day. Unfortunately, meat's finished. All those things, you can't get any more rice, you can't get any oil, you can't get toilet paper. He's one of our lovely neighbours. Yeah, and that's it.
With elderly people most at risk from the virus, Australian health authorities are closely monitoring aged care facilities. Already, a 95-year-old from a Sydney nursing home has died after a staff member contracted the virus.
We don't want to get sick, do we? But what can we do?
While the Holy Family nursing home has so far escaped the virus, it's a constant topic for 84-year-old Jane Malashak and her fellow residents.
The residents are talking, you know, and they're worried that it's going to come here and gets worse.
Hi Jane, how are you going?
I'm not too bad.
That's good. Do you mind if I see it? The staff and sometimes the families particularly are very concerned about their loved ones, of course, which is understandable. And we're taking extra precautions in regards to the coronavirus.
There's been no sign of the coronavirus at the centre, but they're already preparing for the worst.
Immediately that a resident is identified as having any symptoms, even prior to being diagnosed, we fully isolate their room.
Today, the New South Wales Health Minister advised that groups of children should not visit nursing homes. Here at Holy Family, visits are still allowed, but that could soon change.
We need to have a measured approach, but be very, very aware that there is a much greater risk as time goes on.
Because we're older, we're not so strong, and we seem to catch everything that's going around. And that's why we're worried.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.